For over 50 years, dentists around the world have relied on Coltene's broad range of high-quality dental products. Now, Coltene is proud to introduce Fill-Up, the latest product in their line of aesthetically pleasing filling materials. Fill-Up is a dual-cured, medium-viscosity, flowable bulk composite that makes it easy for clinicians to take advantage of one of the newest trends in restorative dentistry, filling Class 1 and 2 cavities with just one composite layer instead of multiple incremental layers. Designed for direct bulk fill restorations in the posterior regions, Fill-Up is indicated for Class 1 and Class 2 fillings of any depth, as well as cavity lining and core buildups. To understand why dentists are excited about Coltene's Fill-Up, you just need to remember 3 words: deep, fast, and perfect. What exactly does deep mean? It means that, thanks to its dual curing properties, Fill-Up can be administered and cured in a single step to an unlimited depth. In fact, Fill-Up's single-layer technique is guaranteed even for very deep 10mm cavities. Combining both light and chemical curing properties, Fill-Up provides uniform curing and consistent polymerization at depths that some light cure-only composites will fail to cure. Because light penetration drops so dramatically above thicknesses of just 1 millimeter, conventional light-curing bulk fill materials cannot always guarantee reliable, deep polymerization. Coltene's Fill-Up eliminates this problem and meets the extremely high clinical and technical requirements necessary for bulk fill materials. That said, enabling you to fill cavities of any depth in a single layer is not the only way in which Coltene's Fill-Up saves you time and provides fast results that you can always be proud of. Fill-Up also makes immediate fabrication of the filling possible. Once the tooth is filled, the composite is light cured for just 5 seconds and has such outstanding mechanical properties that adding a top layer is completely optional. In comparison, most competitive products require a covering layer with a moldable composite. In addition, Fill-Up is provided in one universal color, eliminating the need for you to spend time on shade management. Because Fill-Up's fluorescence creates a chameleon effect, this one universal shade, which is between Vita A2 and A3, adapts perfectly to every posterior region situation. You save time while your patients get an attractive, tooth-colored filling that looks good under all lighting conditions. Finally, Fill-Up is supplied in a convenient, easy-to-use auto-mix syringe that saves you time as well. Fill-Up is deep, fast, and perfect. It provides perfect marginal adaptation, perfect polishability, and a perfect end result. A recent University of Geneva research study examined marginal adaptation both before and after a chewing simulation. Fill-Up's clever bonding system passed this test with flying colors. This optimized sealing of the margins increases patient satisfaction by significantly reducing postoperative sensitivity. Fill-Up's material combination of bond and bulk fill composites was specifically selected so that shrinking toward the cavity wall is possible. This property, combined with gentle chemical curing, results in an optimal low-stress polymerization process. Fill-Up contains antibacterial zinc oxide to reduce bacteria proliferation on the restoration surface. And you'll be able to polish this surface to a high luster with very little effort. Surprisingly, Fill-Up's extremely low level of surface roughness after polishing is comparable to what you would expect from a light-curing composite. Fill-Up's unique properties combine to make it ideally suited for a variety of often difficult situations. Its speed makes it an excellent choice for use with patients who have a difficult time sitting still, such as children and the elderly, as well as patients who are handicapped or mentally disabled. Its flowability works very well for small cavities which will not allow for modeling. In these cases, fill-up offers the additional benefit of a minimally invasive restoration that will not harm the tooth substance, something which would not be possible with a modeling composite. In addition, fill-up is useful for blocking out of undercuts. Regardless of the situation, achieving a perfect end result with fill-up is easy. Once the tooth has been prepared, surround it with an arched matrix. With the help of the supplied mixing tip, dispense fill-up directly into the cavity. Be sure to place the mixing tip inside the composite and overfill the cavity in a single step within 1 minute, starting at the deepest point. Next, either wait 3 minutes for setting or light cure for 5 seconds. After that, simply polish and finish. For best results, fill-up should be applied together with Parabond bonding agents A plus B and finished with Coltene's Alpen Composite Plus or Alpen Swissflex polishers. Parabond accelerates the curing at the cavity margins, further optimizing the filling's marginal sealing. This in turn prevents the formation of marginal gaps and secondary caries. If desired, a separate surface layer of Coltene Synergy D6 composite can be applied to enhance aesthetics and wear resistance. However, this surface layer is completely optional and is not required to ensure good mechanical properties. In conclusion, Coltene's fill-up is a dual-cured flowable bulk composite designed to fill Class 1 and Class 2 posterior cavities of any depth in just 1 layer. Fill-up provides a thorough and gentle curing process that minimizes shrinkage stress and optimizes marginal adaptation. It's an attractive, tooth-colored, metal-free amalgam replacement that makes it easy to achieve deep, fast, and perfect results. Exactly what you would expect from Coltene.